It's news based on lab results that have just come out. Because in the past, our laboratory capacity was very limited in Sierra Leone. We had only about 2 labs, one in Kailahun, run by MSF, and one in Kenema, serving the whole country. So the turnaround of lab tests was very slow. But recently, on top of those 2, we now have the Kerry Town run by the British. We have the Jue Hospital, 2 labs there run by the Chinese. And we have the Laka Hospital where we have South Africa. So our capacity to turn out results is about 5 times now. I believe that Kerry Town alone, they could turn out about 300 results a day, while in the past the laboratories could only do something between 20 and 50 lab tests a day. So those results are results of backlogs. These are not new cases that are in the community. They are cases that were already in holding centers, waiting for their results. It is only now that the results have come. So they are not new cases in the sense that they were unknown to the system. We knew them. We know they were in holding centers. We were only waiting for confirmation. But also, most of the results that came out were also swabs from people who had died. But we needed to know the status and reason for their death to find out whether it is Ebola or not. Because now we are practicing what is called medical burials. So every death in Sierra Leone is treated as an Ebola death until proven otherwise, later, posthumously even. So what we do here is that we send the swabs after the burial. And most of the results that have come are results of the people who had died. Mercifully, most of them turned out to be negative of Ebola. But there are some who have been positive. So if you see high numbers coming out, it is because the laboratories are turning out higher quantity, larger output now than before, and it is based on results of cases that already existed within holding centers. And I say this because I do know that in my own district of Port Loko, we have added about 350 new bed capacity, most of which are empty because there are not many people coming out of the community anymore to report to the holding centers. That means that the cases are on the downtrend. And today also, one of our partners, the IMC, that is the International Medical Corps, are opening a new treatment center at Lonsar in the Port Loko district, which is about another 100 beds. And the treatment center the British are building in that same district will be ready in another 4 or 5 days. So before you know, we will be having more bed capacity than patients to go into that. But that is what we want as a government and as a people. So the news itself is not all that bleak anymore. It means that we may have turned the curve on the Ebola outbreak in Sierra Leone. Hello, Kami, I didn't quite hear that question. Could you speak louder? Believe me, I'm sorry. I didn't hear that. Please do. I don't know. I don't know whether you're talking about the British treatment center that was set up in Kerry Town. If that is the case, yes, I can answer around that. Kerry Town itself is a facility that was built for about 90 patients. But when it was turned over to the British, when it was almost 60% complete by government, it was assumed that they were going to present us with a treatment center that would cater for all medical staff, because for us, the medical staff are few and far between, and when they contract the disease, they needed to know that there is a place they could go to and that they would be able to be helped, nursed back into health. So the British running Kerry Town was the idea. But we understand now that since about 2 weeks ago when it was up, only about 11 patients have been admitted in there, and this is because these are British citizens, and I understand, and I still have to confirm that, but I understand that they are not accepting local personnel, even if they are doctors or medical workers. But government, I believe, will be addressing the review of that MOU maybe today or sometime in the very near future. I don't think that situation is tenable, and government will not accept it to carry on like that, because there has been a lot of talk about the £280 million the British have put in Sierra Leone. So at least if they have just come here and they've only been able to look after 11 patients, it's not the right use of public money. I believe that that situation will be improved very soon. But on the other hand, local effort has been very robust in Sierra Leone. The police training school I told you about before, that was converted temporarily into a treatment center, has become really the flagship treatment center in Sierra Leone. Only recently it has added another 200 beds to their facilities. And why is this? We have seen that the rate of survival in that treatment center is twice the death rate, the case fatality rate. Example is this: for up to last week, they had admitted about 400 people, about whom only 120 had died, but 250 people had survived. In fact, the two doctors who have newly been infected, i.e. Dr. Songum Briwa and Dr. Konomai, who recently were admitted into that facility, Dr. Songum Briwa has now been tested twice and is showing Ebola negative. And I understand Dr. Konomai himself is now in what they call the recovery center. So maybe between today and tomorrow, when his lab results come out, he should also be pronounced that yes, and then there will be the first doctors who would have survived the virus after catching it in Sierra Leone, which means that the local effort is not only robust, but it's effective in the sense that they must have found the magic bullet or the silver bullet to actually deal with the situation here in Sierra Leone. That is why, through this medium also, let me appeal also to our own ECOWAS president to talk to the African Union. They are putting aside $30 million contributed by the ministers, by business people from Africa to help recruit experts from outside to come here. If it is difficult to recruit those experts, they should bring some of that money here, look inwards, and recruit our own experts in this country and train them. I believe that they can face that situation, because the soldiers and the police in the treatment center at the police training school have proven that. And that is a good success story. That is why today you see the numbers are going down. So the news you have is slightly behind the effort that government is putting in place. Your news is a little bit, I would not say stale, but we are ahead of the curve at the moment. The situation is improving. Sorry, I don't know if it's my phone that is bad or your voice is really extremely soft. Could you speak slightly louder, please? Yes, I just heard that. Yes, I can hear you. Yeah, well, the UK took over the treatment center because we, at the time, were looking for resources and expertise from outside. Don't forget that this disease was new in the region, and very little had been done by way of research or even studying that disease, because nobody ever expected that we would ever have a situation like this Ebola. So there was very little knowledge here. It was a new ground, a new field for us. So Britain, when called upon, and they responded effectively, they were coming here to help. So of course what we want was the flagship treatment center that we handed over to them. I believe now they say they're trying to ramp up the numbers coming in there, and the initial 11 were maybe just a case of trial, but they still have a lot of vacancy, a lot of beds that are unused occupancy, which we will help in the fight here. very badly, very badly. We are a resilient people. And most of our economy, 75% of it is agrarian. People depend on agriculture. People depend on the cabbage patch behind the house for them to survive. And I think that has helped us because the cabbage patches are still there. What it has affected is the commercial agriculture, which normally would account for some 10 to 20% of our GDP, which has been affected in the cocoa and cacao regions where this epicenter first came out. But we are coping as a people. It's been difficult, it's been tough. The mining companies, some of them are folding up, some of them are suspended operations, and some of them are announcing that they're going to cut down on their activity. And these are the people who employ large numbers of our people and also cover most of the activity, the economic activity in country. And we know that the royalties are going to go down and the budget is going to be affected in that sense. So we are bracing up. We're bracing up for some hard time. We're going to pull up our belts and tighten them and hope that we will have to go into some kind of austerity measures in order for us to go through that difficulty. But the people of the country are resilient and very understanding, and they are preparing themselves for that. One of the things they're asking government to do and must do quickly is that they are asking for another lockdown. This time not even for 3 days, they're asking for 7 days. The petty traders in the country had asked through the mayor of the city that they were ready to stop trading on Fridays and Sundays as of last week. But the president thought that it is better if it is dealt wholesomely, holistically. So if we are going to shut down, we shouldn't do it in parts or in selected days. We should find a way of doing it such that it has a full effect on the economy and also on the public health of the people. So we have a population that is actually on the side of government in this fight. That is why you haven't heard a lot of disturbances here and there. The people are very resilient and also very understanding of government's efforts. Unlike in the past when I spoke to you, you would have difficulties, people would be phoning that somebody had died for 2 or 3 days, they had not been collected and all that. But the policy of burying every dead person as an Ebola patient has paid off dividends. So there are no more backlogs of burials. Because we now have the safe burial, and then people will get results later on of their relatives to know whether they were in fact Ebola affected or not. I must say that the majority of people dying in Sierra Leone are still from other causes rather than Ebola. For instance, I have a result of 49 deaths in front of me, and only 16 of those are Ebola related deaths. All of the other 23 other causes. So that's the trend. So really we're doing well as a government. We must pat ourselves slightly on the back. Hello?